Okay, let's unpack this. We're diving deep into, well, arguably the single most critical piece of a successful Social Security disability claim, your medical evidence. For so many people, it feels less like a process and more like navigating some kind of bureaucratic labyrinth blindfolded. So our mission today is to really cut through that complexity. We want to offer you the strategic insights, the clearest roadmap to build a truly compelling case. Think of this as your shortcut to understanding not just what to do, but why it matters and how to master it.
And what's often overlooked, and frankly, what's truly fascinating here, is just how many legitimate claims struggle. It's often not because the disability isn't real, but because the medical evidence isn't presented with the right kind of precision. The Social Security Administration, the SSA, they rely so heavily on this documentation. Getting it right isn't just like a nice to have. It dramatically, really dramatically increases your chances of approval.
So when we talk about acceptable medical evidence from the SSA's perspective, it's clearly not just about saying how you feel on a bad day, right?
Right.
What are they really looking for?
Exactly. The SSA needs objective medical evidence. We're talking about tangible proof here. Things like lab findings, imaging, X-rays, MRIs, other diagnostic tests that definitively confirm the condition's existence and, crucially, its severity. The core purpose is to provide concrete, measurable proof that your condition is severe enough to stop you from doing what they call substantial gainful activity. That phrase is key. It means earning over a certain amount each month. They meticulously evaluate your case against established criteria. They often use their Blue Book listings.
The Blue Book?
Right, for specific impairments. And critically, they assess your residual functional capacity, or RFC. That's basically a formal evaluation of how your impairments impact your ability to do work-related activities. Sitting, standing, lifting.
Okay, and here's where I think it gets really interesting and maybe surprising for claimants. There's this sort of subtle but powerful hierarchy of evidence that the SSA weighs. It's not all equal, is it? What kind of evidence holds the most sway, the most controlling weight, as you put it?
That's a crucial strategic insight. Absolutely. Top of that list, records from your treating physicians. These are the doctors who've been providing your ongoing care, who really understand your condition over time longitudinally. Their opinions carry immense weight. Then come specialist opinions, and then the raw diagnostic results, the tests themselves. Understanding this hierarchy is just paramount. It tells you where to focus your energy. Your treating doctor's detailed, consistent opinion, that can truly be the bedrock of your whole claim.
Knowing that hierarchy, that definitely helps in prioritizing your efforts. Immensely. So, okay, let's dive into the practical proven steps, the things that have helped, thousands of claimants navigate this successfully. We've kind of distilled it down to 5 essential moves for gathering your medical evidence effectively.
Right. Step 1. You need to think of your medical records not just as documents, but like building blocks for your case. And the real insight here isn't just collecting them, it's that a single missing visit, even one that seems minor, can create this kind of inexplicable hole in your medical story that can raise red flags for the SSA. It might imply inconsistency, or maybe that the condition isn't as severe as you claim. So it's not just about what you have, it's making sure there aren't these weird, unexplained gaps.
That's a powerful way to think about it, gaps being potential red flags. So how do you approach collecting these building blocks? Who exactly are we talking about here? Your family doctor, every specialist, every single ER visit. I mean, where do you even begin to make sure no critical stone is left unturned?
You need to think comprehensively. Every single relevant provider, you have to make a complete list of anyone who has examined you, prescribed something, tested you, or even just talked to you professionally about your condition. Yes, that means your primary care physician, absolutely. But also every specialist, cardiologists, neurologists, orthopedists, mental health professionals, physical therapists, even chiropractors, hospital emergency departments, urgent care centers, all of them. Once you have that exhaustive list, the process is contact each provider's medical records department. You'll need to prepare the necessary 502P release forms. Privacy is obviously key, and be very specific about the date range you need. Usually that's from when your condition started, the onset date, right through to the present, maybe even a bit before that, just for context.
Okay, so step 1 is building that comprehensive historical archive, meticulously. Then the real strategic play starts, right? It's not just having the records. You need your doctors to translate that history into the language the SSA understands. They're expert opinions. That's your powerful argument. Which brings us neatly to step 2. getting those detailed doctor statements and opinions.
Absolutely. Detailed statements from your treating physicians are, well, they're invaluable. They provide context that just the raw records alone cannot give. These are often called medical source statements or residual functional capacity assessments, or RFC forms again.
Yeah.
These forms basically guide the physicians to evaluate your ability to perform various work-related activities in very concrete terms.
Okay, so what specifically are they looking for on these forms? What kind of functional limitations are they trying to quantify?
They'll assess very specific limitations. Things like your ability to lift and carry weight, how long you can stand or walk in a workday, your sitting tolerance. Also, manipulative limitations reaching, handling objects, fingering, like for typing. They'll even look at environmental restrictions, sensitivity to fumes, dust, noise, and crucially, cognitive aspects like concentration and memory issues. And the key concept here, as we touched on, is controlling weight. That's not just jargon, it's the bedrock. It means you're treating doctors' detailed, consistent opinion, especially when it's backed up by objective tests and clinical findings. It essentially steers the SSA's decision. If they consistently document your limitations with supporting evidence, it becomes incredibly difficult for the SSA to argue otherwise.
So what does this mean for your claim if you're listening? It sounds like general statements like, patient has trouble working, just aren't going to cut it right. The SSA needs specifics, almost like a forensic analysis of your abilities.
Precisely. Vague doesn't work. We need highly specific functional limitations, and they must be supported directly by clinical findings, by the objective evidence. A statement like, patient is limited, carries far less weight than patient can lift no more than 10 pounds occasionally and must alternate sitting-standing every 30 minutes due to documented degenerative disc disease seen on MRI. That specificity gives the SSA the concrete, actionable details they need to evaluate your claim against their strict criteria. That's where your doctor's input is gold.
That makes complete sense. Specificity is king. Okay, moving on to step 3, securing specialized testing and diagnostic reports. These sound like the hard, measurable data points that really speak volumes to the SSA. What kinds of tests we're talking about here? The ones that provide that crucial objective evidence.
Yes, these are truly critical. They provide that irrefutable evidence the SSA really values. So you have imaging studies, things like MRI scans, CT scans, X-rays, ultrasounds, even bone density scans. They show structural issues, right? Damage, abnormalities. Then there are laboratory tests, blood work panels, maybe genetic testing depending on the condition, hormone level assessments, inflammatory markers like C-reactive protein. These indicate disease activity. And finally, functional testing. This is where you measure capacity. Things like pulmonary function tests for lung issues, cardiac stress tests for heart conditions, neurological assessments to gauge nerve function, and psychological or neuropsychological evaluations for mental health or cognitive impairments. All of these translate your symptoms into measurable objective data.
That's a really comprehensive list of what the SSA leans on.
Okay.
Step 4 then focuses on documenting your complete treatment history. This isn't just about showing you're unwell. It seems like it demonstrates you've been actively pursuing care, and it shows the progression. Why is that active pursuit so vital?
It's vital because it establishes 2 really critical points for the SSA. First, it shows you're actively seeking medical care for your condition. You're engaged. Second, it demonstrates that you are, generally speaking, compliant with the treatments your doctors prescribe. This helps show the progression and the persistence of your condition. It demonstrates your consistent effort to manage it, to get better if possible. Your documentation should meticulously include all your medical treatments, medications you've been prescribed, and crucially, their effectiveness or side effects, any surgical procedures and their outcomes, physical therapy sessions, including the progress notes, injections or other interventional treatments. But also think broader. Consider alternative treatments you've tried, maybe chiropractic care, acupuncture, massage therapy, specific dietary modifications. And definitely don't forget any assistive devices you rely on. Wheelchairs, walkers, canes, braces, supports, hearing aids, vision correction devices. Every piece helps paint that fuller picture.
Okay, but I can imagine in the real world, things get messy. Life happens. What about those situations where someone might have gaps in their treatment? Maybe due to financial hardship or just sheer exhaustion from being ill.
Mm-hmm.
Is that an automatic problem? Or are there ways to address those, legitimate breaks in care?
That's an excellent and very common question. The SSI does expect claimants to pursue reasonable treatment. So yes, unexplained gaps in treatment or Failure to follow medical advice can negatively impact a claim. However, and this is important if you have valid reasons, they can be accounted for. They should be explained. Things like documented financial hardship preventing access to care, or maybe severe side effects or adverse reactions to treatments, or even a situation where a doctor advises against further treatment because it's not helping or the risks outweigh benefits. The key is communication. Explain these gaps thoroughly and honestly, ideally with some support from your doctor if possible.
Okay, that's reassuring. So you've gone through this massive process, gathered everything, you've been a medical detective, now what? You said earlier you can't just dump a box of papers on their desk, right? So step 5 is all about organizing and presenting your evidence effectively. How do you do that?
You absolutely cannot just dump a box. Think of it like presenting a legal brief or maybe even a well-researched report. Clear, logical organization makes it significantly easier for the SSA reviewers to understand your case. And honestly, it can dramatically impact the claim's outcome. They're reviewing hundreds of files. Make yours easy. We generally recommend creating a clear filing system. Several ways to do it. You could use chronological organization, arrange records by date, oldest to newest. Use clear dividers for time periods, maybe include a concise timeline of significant events up front. Or some prefer provider-based organization. Group all records from Dr. Smith together, then all from Dr. Jones, including their contact info or specialty. If you have multiple serious impairments, sometimes condition-based organization works well. Separate records by medical condition like cardiac records, orthopedic records, and cross-reference where needed. But perhaps most importantly, regardless of the system, include a comprehensive summary at the very beginning. This summary should explain how each major piece of documentation supports your disability claim. It needs to connect the dots directly to the SSA's criteria, clearly demonstrating how your conditions prevent you from working. It's your narrative guide through the evidence.
That summary sounds absolutely critical, like the executive summary of your entire case. Okay, now that we know what to do and how to do it strategically, let's pivot slightly. Let's talk about what not to do. What are some of the critical pitfalls, the gotchas that claimants often fall into, even people who think they've done everything right?
Oh, there are definitely several common mistakes that can really jeopardize a claim, even a potentially strong one. First, probably the most common, incomplete medical records. Failing to get records from all treating providers, even that specialist you saw twice 3 years ago. Get it. Second, outdated documentation. Your evidence needs to reflect your current functional limitations, not just how you were a year ago. Third, and this is a big one we discussed, lack of specialist opinions. Relying only on your primary care physician, especially for complex conditions, can really limit the strength and depth of your evidence. Fourth, poor organization. Submitting a disorganized, difficult-to-follow pile of documents is a major barrier for the reviewer. You're making their job harder. Fifth, missing objective evidence. Focusing too much on subjective complaints, how you feel without the supporting objective medical findings, like tests and imaging, that reduces credibility in the SSA's eyes. And finally, inconsistent treatment. As we discussed, irregular medical care or not strictly following prescribed treatments can suggest, rightly or wrongly, that your condition isn't as severe as claimed. Unless, again, there are clear documented reasons for it.
That's a great list of don'ts. Avoiding those seems just as important as doing the Dorjes right. Okay, this brings up some important questions, and these are ones we hear pretty frequently from listeners. Let's strip and tackle some of the most common FAQs that will likely apply directly to your situation if you're navigating this. First up, how far back should someone actually gather medical evidence? Is it just the last year, or do you need to go way back?
Good question. Generally, you should gather medical evidence dating back to your alleged onset date of disability. That's the date you claim your disability began preventing work. And ideally, it's best practice to also get records for a full 12 months prior to that date. Why? Because that provides crucial context. It helps show the progression of your condition, allowing the SSA to see the full story, and helps establish when your disability truly began impacting your ability to work.
Okay, 12 months prior to onset. That makes sense for context.
Yeah.
What about records from, say, nurse practitioners or physician assistants, PAs? Do those carry the same weight as a doctor's records in the SSA's view?
Yes and no. Records from NPs and PAs are absolutely acceptable medical evidence. Their treatment notes can be incredibly detailed, very thorough, and really supportive of your claim. However, and this is a legal distinction in SSA regulations, their medical opinions about your functional capacity, like on an RFC form, do not legally carry the same controlling weight as those from a licensed physician, MD or DO. So while their treatment notes are valuable evidence, you really want to aim to get a physician's signature and opinion on those key RFC assessments, if at all possible.
That's a really important distinction. Okay, here's a practical one for many people. What if I simply can't afford to pay for copies of my medical records? Some offices charge quite a bit per page. That can be a real financial barrier.
It absolutely can be, and the SSA understands that to some extent. Many healthcare providers actually offer reduced fees or sometimes payment plans for medical records, especially if they know it's for a disability claim. You should always ask. Additionally, if you decide to work with an attorney or a non-attorney representative, they can often obtain records on your behalf. They frequently have established relationships with medical facilities that can streamline the process, sometimes even at a lower cost or with the costs deferred until the case resolves.
That's good to know there are options. What about tricky situations, like trying to get records from providers who have closed their practices or retired? It can feel like trying to find a ghost sometimes.
It can feel that way, definitely. Your best first step is usually to contact the state medical board for the state where the provider practiced. Or you could try contacting the hospital where the provider had admitting privileges. Many states have strict requirements for how patient records must be maintained or transferred even after a practice closes. They often designate a specific custodian of records. It might take some digging, but the records usually exist somewhere.
Okay, persistence is key there. How about mental health records? Should I include those, even if my main disability is purely physical, like, say, a severe back injury? It might seem unrelated to some.
Yes, absolutely yes. Mental health records can be profoundly important, even if the primary disabling condition is physical. Why? Because many chronic physical conditions frequently cause or worsen secondary mental health issues, things like depression, anxiety, maybe chronic pain syndrome, which has psychological components. Including these records paints a much more complete picture for the SSA of how your disability affects your overall functioning, your mood, your energy levels, your concentration, your ability to interact with others, and ultimately your capacity to sustain work. It provides a holistic view.
That makes a lot of sense. It's about the total impact.
Mm-hmm.
And finally, one last thing that I think often confuses people. We hear the terms medical evidence and medical opinions used almost interchangeably sometimes. But for the SSA, you've emphasized there's a critical distinction. Can you just clarify that one more time? What separates them, really?
Sure. It's a crucial distinction to grasp. Medical evidence primarily refers to the objective findings. These are things like your test results, the numbers on a blood test, imaging studies, what the MRI report says, lab reports, factual clinical observations made during an exam range of motion measurements, for example. It's the data. Medical opinions, on the other hand, are the healthcare provider's professional judgments about your specific functional limitations and your ability to work based on that objective medical evidence.
Yeah.
So evidence is the raw data, the findings. Opinion is the doctor's expert interpretation of what that data means for your day-to-day life and your capacity for work-related activities. Both are important, but they serve different roles.
Evidence is the what? Opinion is the so what?
That's a great way to put it, exactly.
Okay, so there you have it. Gathering medical evidence for your Social Security disability claim is, well, it's truly foundational. It's the bedrock of your entire case. By following these structured, strategic steps we've talked about and consciously avoiding those common pitfalls, you really do significantly strengthen your case. You dramatically increase your chances of success.
And remember, knowledge is always most valuable when it's understood and then actually applied. This deep dive hopefully has armed you with some critical, actionable insights. It helps turn what can seem like this overwhelming, confusing task into a much more manageable and strategic process. It really empowers your claim.
And maybe, if we connect this to the bigger picture for a moment, just consider how proactively understanding the documentation requirements for any significant life application, whether it's a loan, maybe an insurance claim, or even a professional license, how that understanding can empower you. It just ensures you're always ready to present your most compelling case. Because really, these principles of thoroughness, organization, and strategic presentation, they truly apply almost everywhere.